Assalamu alaikum dear doctors. In this video I am discussing immunothrombocytopenic purpura ITP from the NICE guideline. So the definition of ITP is that we know that when platelet count is less than 100 into 10 to the power 9 per liter, usually less than 20 into 10 to the power 9 per liter. It is a self-limiting disease with shortened platelet survival and increase the megakaryocytes. Good prognosis, acute is 0 to 3 months durations and persistent is 3 to 12 months durations and chronic is more than 12 month durations. Now, the symptoms and signs of the ITP. These are acute onset bruising, purpura and petechiae. There is serious mucosal bleeding, unusual, look for other causes. Absence of hepatosplenomegaly, lymphadenopathy, evidence of any serious cause or chronic underlying illness. Now, what investigation we do for ITP? These are full blood count, blood film and clotting, blood grouping. If headache and neurological signs, urgent CT scan of the head, bone marrow aspiration unnecessary unless there is neutropenia or severe anemia, hepatosplenomegaly, lymphadenopathy, pallor and there is lassitude, pain in the limb, abnormal and abdomen and back, lymph, cytomegalovirus and Epstein-Barr virus, immunoglobulin M, if risk factors, HIV and hepatitis B and C. Treatment of ITP, the immediate treatment including none regardless of platelet count unless life-threatening owing to significant bleeding. If significant bleeding, example uncontrollable epistaxis, GI hemorrhage, and intracranial bleeding, give the methylprednisolone 30 mg per kg per day by IV infusion, maximum 1 gram per dose for 3 days, or immunoglobulin 0.8 to 1 gram per kg can be repeated once within 3 days if required. Red indication in the demand management program for immunoglobulin. If moderate bleeding, example prolonged mucosal bleeding, give prednisolone 2 mg per kg per day for 14 days, then taper over 21 days, or prednisolone 4 mg per kg per day for 4 days, or immunoglobulin 0.8 gram per kg IV single dose. Consider tranexamic acid for small bleeds. Avoid NSAID, example ibuprofen. Reassure the parents. Discuss newly diagnosed ITP with the pediatric hematologist and pediatric consultant with a hematology interest. Discuss treatment with the platelet with pediatric hematologist in event of essential operations and emergency details dental extractions. Now the subsequent management of ITP is that 75 to 80% resolve in 6 months. Favorable outcome irrespective of treatment. Avoid contact sports. Possible to prevent fighting or rigorous knockabout games at home. Parents can find additional information from ITP support associations. The ITP monitoring treatment, that is full blood count and film monthly until diagnosis clear and recovery. Repeat sooner if bleeding or increased bruising. Discharge and follow-up is that discharge from long-term follow-up when platelet is more than 100 into 10 to the power 9 per liter and asymptomatic. Advice of risk of relapse 20%. Note that mothers with history of ITP, even if they have normal platelet counts, can give birth to thrombocytopenic babies. Now chronic immunothrombocytopenic purpura, they avoid NSAID, avoid contact sports, investigated for autoimmune disease like ANA anti-nuclear antibody, APLA antiphospholipid antibodies, ACA anti-cardiolipid antibodies, and LAC lupus anticoagulant, and immunodeficiency HIV, immunoglobulin G, immunoglobulin A, and immunoglobulin M. Treat only profound thrombocytopenia less than 10 into 10 to the power 9 per liter with repeated mucosal bleeding, older girls with menorrhagia, trauma, acute neurological signs. If treatment indicated, give prednisolone 2 mg per kg per day 14 days, then taper over 21 days, or dexamethasone 0.6 mg per kg per day, maximum 40 mg orally for 4 days if ongoing bleeding. Must have bone marrow aspirate before treatment. If unresponsive, discuss with the pediatric hematologist about treatment with rituximab or thrombopoietin receptor agonists. Spironectomy reserved for those with persistent or significant bleeding, non-responsive or intolerant of other therapies. So this is all about ITP. Thank you.